when I do this, I'm going to say take 500. Okay, ready? Hi, how are you? I'm going to be asking you a few questions about your history.
Okay.
Have you had a history of any headaches, dizziness, head injuries, or loss of consciousness?
No.
Okay, great. For your eyes, have you had any blurry vision, double vision, any visual changes, eye trauma, or any eye diseases? Good. Do you wear glasses or contacts?
No.
Okay, great. For your ears, have you had a history of any hearing loss, any pain, any discharge, vertigo, which is dizziness, or any tinnitus, which would be ringing in your ears?
No.
Okay, great. For your nose, any nasal congestion, any nosebleeds, or postnasal drip?
No.
No? Okay, great. And your throat, any hoarseness, sore throats, bleeding gums, ulcers, or any problems with your teeth?
No.
No? Okay, great. We're going to be getting the physical part of the exam. Okay, I'm just going to inspect your head and your scalp. Okay, your head is symmetric, the shape is round, and the size is appropriate for the patient. Can you raise your eyebrows for me? And regular? Okay, can you give me a smile? Okay. Okay, very good. Your face, your features are symmetric throughout. Your scalp is symmetric, and there was no abnormal movement. Was there any tenderness when I was palpating? Okay, and I didn't notice any lesions, tics, or any unusual features. When I was assessing your face, your head, your scalp, did you feel my hands?
Yes.
Okay, great. There was no tenderness?
No.
Okay. Your master muscles are good, and your facial functions appear great. I'm just going to be looking at your neck. Okay, looks symmetrical. Very good. I'm going to put my hand here. I want you to turn this way for me. Okay, great. And now the other, I want you to turn here. Okay, your sternocleidomastoid muscles were strong and intact. Your neck looks symmetric. Can you look up for me and down and right and left? Okay, full range of motion in your neck. I don't see any masses or any scars. Now we're going to be looking at the trachea. Is there any tenderness?
No.
Okay, great. I'm going to ask you to take a sip of this water for me. I want to observe you taking a sip. Okay. And one more sip of water. Okay, great. I could take that from you. Okay. I'm just going to take a quick listen to some of your arteries. Okay, good. And I'm just going to palpate your lymph nodes. Any pain or tenderness?
No.
Okay, very nice. And I observe your anterior triangle and your posterior triangle. I'm now going to listen over your eyes. Can you just close your eyes for me? I'm listening over your thyroid. Okay, no bruits were present. And can you open your mouth for me and close? Any tenderness? Okay, great. Now we're going to be moving on to the eye exam. Okay, so can you take a look at me? Close your eyes and open. Okay, good. Can you just look at my light for me? One second. Okay, can you look at the far wall, the clock, and now at my finger? Okay, pupils are equal, round, and reacting to light and accommodation. Great. Just going to be looking at your lacrimal glands. Okay, very good. I don't see any orbital edema, sagging, or drainage. Your eyelashes, your eyebrows, and your eyes are symmetrical. I didn't see any foreign bodies in the conjunctiva or the sclera. The color and condition is appropriate. There's no discharge. I'm just going to take a quick look at your corneas. Okay, very well. There's no cloudiness, ulcers, or abrasions. I also am going to ask you to turn back for me, turn your head back, and I'm going to, just like this, sorry. Okay. Okay, that was testing your intraocular pressure, and the result is -3, which is normal. Okay, I'm going to take this cotton swab. Can you open? I'm just going to touch your, no, open your eyes. I'm just going to be touching your cornea with this. Okay. Okay, very well. Your cornea is clear, and you had a reflex to the touch. I'm now going to be looking in your eyes with my ophthalmoscope. Can you just look at me? Okay, great. I visualized the red reflex. Your lens clarity was transparent. Your blood vessels were not bulging very well. Your optic discs were defined. And your macular characteristics, I will be looking at that right now. Okay, very good, sir. Okay, now we're going to be doing vision testing. Can you please read that line right here for me and cover your right eye?
D-E-F-P-O-T-E-C.
Okay, great. Can you cover your other eye? And now read it backwards.
C-E-T-O-P-F-E-D.
Okay, great. You have 20/20 vision for your far vision. Now we're going to be testing up close. Okay. Can you please read the first 3 things?
Vacuum, clean tub, laundry and distract.
Okay, great. That's the nurse's to-do list. Okay. Okay, just tell me when you see my fingers. Nope, just look at me, sir.
See. 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 See.
Okay, can you cover one eye? And again.
See. See. See.
Now cover the other eye.
See him. See him. See him.
Okay, very good. Just gonna look again at your corneas. Okay, great. No abnormal blinking. And can you close your eyes for me and try opening them? Okay, great. Last but not least, we're going to be checking your extraocular muscles. So can you oh, we just did that. Sorry. Okay. We're moving on. Okay, to the ears, nose, and throat. So I'm just going to be inspecting your ears. Can you turn for me? Okay. Okay, the the size and shape are appropriate. Moving on. I'm just going to be looking inside your ears right now.
Mhm.
Okay, great. The light reflex was present. The tympanic membrane was pearly gray, and I didn't notice any discharge. Was there any tenderness? Okay, there was no inflammation and there was no drainage. Now I'd like you to tell me if you hear the sounds equal in both ears.
Yes.
Okay, great. Please tell me when you stop hearing each sound.
Now. Now.
Okay, and again.
Now. Now.
Okay, sir, great. I'm just going to be inspecting your nose. Any tenderness? Okay. Can you please breathe in for me? And again? Okay, very good. Can you please smell this? One second. Close your eyes and smell this.
Beans.
Okay, good. And can you smell this?
Marker.
Okay, good. The patient is able to distinguish between differences in smell. I'm just going to take a quick look in your nose. Can you look up for me? Okay, very good. I don't notice any bleeding or palpations or masses. Was there any tenderness?
No.
Okay, good. No septum deviation and no perforations. I'm now going to be looking at your mouth. Can you open up? Can you say ah? Your uvula is midline. I don't notice any lesions. Can you please smile for me and open up your mouth? Open up your mouth, please. Okay. No bleeding on your gums, no edema, no inflammation, no hypertrophy. Very good, sir. Okay, can you please stick your tongue out for me? And to the right and left? Okay, very good. Can you please open your mouth once more? Okay, let me just use my way. Okay, the salivary glands are good. The uvula was midline, and your hard and soft palate's look intact. Last but not least, can you please smile and clench your teeth? Okay, teeth are strong. That concludes our exam. Thank you, sir.
Yep.
All right, I probably